Small business owners are also struggling to find affordable health coverage. Unable to pay monthly premiums, many decide to go without insurance. But where do they go for medical care? 33-year-old Doug Wood is getting medical services for a foot injury at this new one-of-a-kind urgent care center, the only urgent care in the county linked to a community health center. Doug is among thousands who are trying to avoid going to the emergency room for medical services and paying thousands of dollars in bills. He's learned from a recent past experience how costly that can be.
2 months later, started getting these bills, all these other, the doctor's bill and the emergency services bill, and I'm just like, it's overwhelming. I'm not trying to stay in debt, but it's overwhelming.
Doug is a contractor, but business has considerably slowed down and he can't afford health coverage. And he's not alone. In San Diego County, there are just over 500,000 people who don't have health coverage. It's the same reason why Dr. Ruth Cavell from UCSD School of Medicine says community clinics play a vital role.
The community health centers that serve San Diego, which are loosely affiliated to the Council of Community Clinics, are an absolutely vital safety net for our community. And I think being one of the largest, we play a very important role in that safety net.
In recent months, partially due to the economy and the high cost of health coverage, there has been a steady increase of patients seeking medical services at community health centers.
The local recession has dramatically increased the number of residents without health insurance, which has resulted in a large number of people coming to the health center for services that they desperately need. So that's caused all the health centers in our community to expand their services, to hire more physicians and dentists, to respond to the increased need.
Through the years, community health centers have evolved. Today, many have multi-million-dollar budgets, state-of-the-art equipment, comprehensive health services, including medical and dental, and more. Their funding comes from different sources like private donations, federal, state, and local grants, Medicare, and private health insurance.
Community clinics, by the way, have grown tremendously sophisticated in the quality of care. And some people go because they really enjoyed the sophisticated level of quality of care. You actually get a chance to interact with the providers. Things tend to be more integrated. You have the prevention along with the treatment. Actually, people get quite often very good quality care.
Meantime, as patients navigate through the healthcare system, the future remains uncertain. For now, patients can only wait and hope for the best.
We're at the table on healthcare reform in this country right now because of costs. It's costing people too much money. And the reason why we have a healthcare system that costs too much money is very simply, people don't have access to care on a timely basis, primary care is not emphasized, and prevention is not emphasized. And community health centers do all of those things.